In this second part, I'll be mainly dealing only about surgery. What are the preparations for surgery? What you can expect from the hospital and the operating doctor? The post-operative care, the do's and don'ts at home. Now, once that we have come to a diagnosis, the next step, whether it is low grade or high grade, the basic necessity is surgery has to be done, is a must, which is for both for low grade and high grade, the malignancy along with the salivary gland has to be removed. So I am going to tell you about, since it is common in the parotid, I am going to tell you about parotidectomy. Now, it has been decided the surgery has to be done. So already you have done so many investigation which is related to diagnosis. Now, to prepare you for surgery, we need to do so many blood tests so that you are fit to be taken to the operation theatre, which includes the blood test, not only blood test, but chest X-ray as well as ECG too. So with all these reports, you are supposed to go and meet the anesthetist. He may ask you to get a clearance from physician or from the cardiologist also. And once that is done, and once you have got a date, one day prior to that, you need to be admitted. So the day of admission, they will take a concern from you, and in that concern paper, it will be written your diagnosis first, what is the surgery going to be performed, the complications related to it, which I'll tell you the next, and you go through the whole thing in detail, and the patient need to sign along with the witness, and the doctor also will sign. So that particular night, next day is the surgery, from 12 midnight onwards, you are not supposed to drink anything or eat anything. Next day morning is the surgery. So let me tell you about the complications first. Following parotidectomy, removal of the gland and the malignancy, this part there may be blood collection inside, which usually happens 1 or 2 days after surgery. There is a possibility of infection which usually follows the 3rd or 4th day. There is a possibility that the facial nerve may get damaged. Maybe the patient already has presented in a late stage and he has already come with the facial nerve damage. Or some patients during the surgery itself will come to know the whole tumor, it's engulfing, it's completely covering the facial nerve. So there is a possibility that the facial nerve may get damaged. We will try to preserve the facial nerve as much as possible. Frey syndrome, which means whenever the patient takes food, they will be sweating in that particular area. Last one, if there is a compromise of the vessels, blood vessels of this particular area, there will be necrosis. There will be anesthesia, numbness, followed by discoloration, which becomes black, and the whole area may slough off. But usually this is seen if the patient is old, anemic, diabetic, skin texture is not good, reasons like that. Otherwise, it's not that common. Now, I have told you the complications related to parotidectomy. In case we have to do neck dissection, we have other complications too, which I will not be dealing in this video. There's a separate video on neck dissection. You have to see that. Now, once the surgery is done, once the surgery is planned, the patient taken to operation theatre, and it approximately takes about 2 hours. So this one I have shown you the markings, and the incision is going to start from here right down up to the neck. So that is about the incision. Now, the operation after the surgery, the patient will be shifted to post-op ICU, and there will be nil per oral then you will not be allowed to drink or eat anything for next 4 to 6 hours. During this waiting period, IV fluids will be going on, and the staff nurse on duty, she will check your heart rate, pulse rate, saturation, respiratory rate and temperature. Not only that, if there is any associated bleeding or swelling in the area where we have operated. IV antibiotics and painkillers will be going on, and there will be a drain too. This drain, which is a glove drain in this case, it will be removed the next day. Once it is removed, and the stitches like this, once it is removed, everything is fine. After a tight bandage like this, the patient can be discharged. He will be discharged with antibiotics and painkiller, and he will be advised to do wound dressing every 3rd day and to review on the 7th day. The reason for the review for the 7th day is we plan to remove the stitches, and by that time your biopsy report will be ready. So with this biopsy report, we will come to know whether you have a low grade or high grade. If it is low grade, after stitch removal, that's it. You have to come for regular follow-up. Now, during this 7 days waiting period, at home, you are supposed to drink a lot of water, and you have to do your normal work at home. Don't sit idle. Take a normal, balanced diet at the proper time. And if there is slight wound soaking, do not be worried. If there is a tightness in the site of the wound, it's normal, don't be worried. If suppose during this 7 days, if you have any of these complaints, please do not wait. Give a call to the doctor and go back immediately. These are high grade fever, pain or swelling, significant swelling, increasing swelling or increasing pain in the area of the operation site, or if there is pin pricking sensation of the wound, or you are not able to turn your head normally, it's painful. You have to, these are alarming complaints, signs, so you have to consult the doctor immediately. Otherwise, it's fine. So after stitch removal, please keep in mind, you are not supposed to look upwards or extend the neck at the extreme position for 2 weeks. Usually, there will be a minor complaint of throat irritation for maximum 4 to 5 days after surgery. This is because of the intubation tube, nothing to be worried about. Now, if it is low-grade tumor with surgery, that's it, you have to come for regular follow-up. If it is high-grade tumor, then you will be referred to oncologist, where they'll decide that you may need radiotherapy also, or maybe to add up, you may need chemotherapy also. So this is how we deal with mucoepidermoid tumor of the parotid gland. Thank you so much.